Good morning, good afternoon, good evening to all of those that have joined us. We'd like to thank you for joining us and taking some time out of your busy day to learn and discuss and hear a discussion on how we're embracing telehealth and looking at virtual care delivery in a post-COVID-19 world and what that situation is going to look like. My name is Dean Douglas. I am the head of our growth and solutions practice, Salesforce practice at Persistent Systems. I also head up our global partnership with Salesforce, and we'll be doing quite a bit of the moderating today. Just wanted to let you know that we will be having some opening remarks from our panelists, Chris and Vinod, and then we will move to a Q&A session or kind of a roundtable session where we'll have some questions that have come up, and our panelists will be able to answer and address those questions related to the overall topic. And then we'll be moving into a demo to give you a little bit more insight onto what the solution, the technology would look like based upon what our panelists are describing here. With that, I'd like to introduce our panelists for today. Dr. Brian Tan is Director of Asia Pacific Healthcare and Life Sciences at Salesforce. Chris Horn is our Senior Director of Industry and Go-to-Market in Asia Pac for Salesforce. And Vinod Parali is Associate Vice President of Healthcare and Life Sciences at Persistent. And they are going to be also our panelists and our speakers today. And with that, I'd like to turn it over to Chris. Chris, if you would like to kind of take us through your perspective on the fundamental shifts you're seeing around healthcare related to COVID.
All right, thanks, Dean. Appreciate that. And if you don't mind just sharing your screen, Dean, if that's okay, just to bring up the slides, that would be awesome. But just while you're doing that, a big thanks to yourself and Persistent as well for having us involved in this session. We're really pleased to be involved. And a big thanks to all those attending today as well. We really appreciate your time as well. So in this section, I'll talk a bit about what we've been observing with our healthcare customers recently as we sort of move into this new normal. And talk to some of the data points that we've seen really start to emerge as well around the adoption of telehealth and virtual care more broadly. So Dean, if we just jump forward a slide, and I think it probably goes without saying, first off, that the impact of COVID has been enormous for providers. And just moving into the next slide to talk through a few of those key impacts that we've seen. I think first off, of course, the integration of the public and private systems to ensure enough capacity has, of course, had a huge impact on private providers. Secondly, the delaying of elective surgeries has had a huge impact, both on the business side as well as to patient care, and the gradual reintroduction and I guess the sort of stop-start we've seen over the last week for these types of surgery also needs really careful management and often new tools to really handle how these rebookings are being handled in a scalable way as well. I think a really key challenge we've seen is that just due to the fact that many people haven't really felt comfortable coming into a clinic or into a hospital, even if they probably should, we've seen this have a huge impact on the business of many providers. Not to mention the fact that those people should probably be getting the care. But we've actually seen some really creative thinking around, how to use digital tools to do things like manage waiting rooms and queues safely as people do start to gain confidence to come back in. And then, of course, we've seen a lot of providers very urgently needing to get telehealth infrastructure established. So in a lot of cases, this has begun really quite simply, by using the phone or Zoom. But more recently, we're really starting to see more of a desire to start to mature that capability further and really do this in a more integrated and more fulsome kind of way. And then I think really sort of sitting across all of that, one of the big challenges we've seen many customers really grappling with has been just that massive influx of calls and inquiries. So this has been a big test of channel maturity, and for many there's been a real need to flex contact center capability or even activate more digital channels to be able to handle that at scale. So in summary, I think one of the clear impacts from COVID has been it's exposed a relatively limited ability to really scale health services to another level. And I think also really highlighted the fact that many organisations are set up to deliver care from a relatively narrow operating model at the moment. And just moving into the next slide, I think that was just a bit about what we've been seeing more recently. course, we're here today to talk about virtual care and telehealth and how that experience really translates for the patient. But I think if we actually wind the clock back just a little bit, even before COVID and before telehealth became such a hot issue, there was actually already a lot of demand from patients for that healthcare experience to really start to evolve. And you can see some stats here, which were from a big healthcare research report that we did actually last year. As you can see there on the screen, 83% of patients actually said they wanted a provider to have that ability to manage a personal relationship with them, so beyond just their medical records. 68% of patients were expecting real-time engagement in the healthcare setting, so not long waits or gaps in communication. And perhaps most substantially, I guess, over 8 in 10 patients actually said they would switch providers as a result of a single poor experience. So it's clear that before the pandemic that there's actually been quite substantial consumerization of healthcare, and I guess we need to start connecting more seamlessly with patients. Just moving into the next slide, I guess when you combine a bit of that history along with now, the COVID world we're living through, it's quite clear we've got a whole set of thinking really emerging around how we approach care. And just in the next slide, if we maybe just go a little bit deeper there into the Australian context. Of course, we've known for some time that consumers have been having great experiences in different industries. So whether that's been booking a place on Airbnb or, viewing content on demand on Netflix, and then they're really starting to form, those higher expectations and carrying those to other industries that they're interacting with as well. And we know in a lot of cases that experience in healthcare hasn't, necessarily always met those consumer expectations. As you can see on the left there, there was a recent Australian survey where 70% of people actually wanted providers to make better use of digital tools. So against that backdrop of, that expectation gap, since COVID began, perhaps it's not that big a surprise, how quickly that new paradigm for virtual care delivery has picked up and, started to be embraced. And a couple of numbers here, when we start to look at, some of these numbers in Australia around telehealth, it was amazing to see, within about 6 weeks of the pandemic starting, nearly 300 items, funded on the MBS schedule. That second number there, perhaps getting a bit old now, but as of a few months into COVID, there had already been around 4 million telehealth consultations in Australia through the pandemic, and largely with really quite good satisfaction as well. And just on the next slide, just starting to sum up and just looking at a couple of interesting data points from a bit more of a global standpoint. First off, it's really interesting to see that the CAGR on telehealth is nearly 40%. So it's actually forecast to grow 7 times over within the next 5 years. I think another interesting data point is that 2/3 of people are actually open to trying telehealth and have said that the pandemic has actually increased their willingness to try it. And there's a couple of really quite amazing stats actually from NYU Langone, where they actually experienced nearly a 700% increase in virtual urgent care visits and over 4,000% increase in non-urgent care visits during March and the first half of April, which is really quite staggering. And just on the last slide, just summing up, there's a great quote here from the CMIO at NYU Langone, which I think just really sums up the change very well. Basically saying that now that people have started to experience this new form of care and the convenience, it's going to be very hard to sort of put that genie back in the bottle. So that's just a few anecdotes of what we've been hearing from customers and hopefully some interesting data points. So with that set up, I'll hand back over to Dean and Vinod to take us into the next section.
So thank you. I'd like to say, Vinod, if you could, give us a little perspective on how you think health systems are going to or can utilize Salesforce in this challenging environment that we're on.
Absolutely, Dean. And if you can move to the slide here. So these are like, 2 drivers that we are seeing with our engagement with our, healthcare patients, healthcare customers, basically. So one is, as Chris also was mentioning about, overall patient experience and what we call healthcare consumerization. So overall, expectation from general population and general patients is basically just the way I use my other services like Netflix and all other retail services. They need that kind of experience with their health systems also. And if you look at the overall healthcare and from technology standpoint where they are, there's kind of tall expectation, and we are seeing that healthcare organizations are trying to kind of go in that direction where they really look at overarching patient experience and how it looks like. And and this journey started, by the way, before COVID, and I think COVID has really accelerated this journey of these healthcare organizations to create similar kind of experience for healthcare patients as well, and overall population. So one of the key driver from my perspective is healthcare consumerization. The second driver is, it is not just ability to book an appointment or to see your provider over video channel, but I think expectation is kind of going further, that as a patient, health system will basically create experience for me. It will be more personalized. It will be more contextual experience for me, and not only limited to just booking an appointment or seeing the provider, but if I'm kind of subscribing to certain kind of from clinical standpoint, because of certain disease conditions that I have, then as a patient, I would expect that kind of care being delivered on my digital channel, right? So the whole notion about just limiting this digital experience to booking and some easiest way to kind of book an appointment, it is not limited to that. I think providers are kind of rolling up their sleeves, and they're trying to think a little bit beyond just booking an appointment and really delivering care using these digital channels. So those are like key drivers from our perspective. And if you look at the priorities, because of pandemic, this whole thing is kind of accelerated from healthcare system standpoint as well, because they cannot cater to higher volumes that they're getting, and whether in terms of calls, whether in terms of visits, whether in terms of just plain curiosity, whether I'm infected or not. I think this whole thing is kind of driving acceleration for digital care, and further we'll talk about specific points. But overall, I think these are some of the priorities that we see from healthcare provider standpoint. Ability to do remote triage, and that's where all these digital channels and Salesforce especially is very important tool that will help health systems to look at their patients and triage those patients. And we are going to see part of that demo towards end of the webinar here. But these are some of the priorities that we see. One is digital, telehealth for triage. Second is delivering care over a digital channel. And then third element that is kind of increasingly applicable more to non-COVID disease conditions, which is more on remote patient monitoring side. So we'll talk more about that part. So from our perspective, Dean, these are some of the observations, these are some of the drivers, and these are some of the priorities from provider perspective. If you go to next slide, we'll talk about some of the points related to why now and what exactly providers are trying to do. As Chris also mentioned in his opening comment, that there is a tremendous pressure on providers to up their revenue, because mostly PCP segment of the business is kind of tapering down slowly, because everybody's kind of treating COVID patients, and then other elements are of health system, whether it is specialty, whether it is any other services, they are a little bit on back burner, right? Because of that, there is a tremendous revenue pressure on providers, and they really need to cater to those patients that are not able to come into hospitals and health system. And telehealth and virtual care rightly fit into this whole equation, and we are seeing increasing traction and increasing conversations around how do they adopt digital channel for telehealth and virtual care kind of initiatives. And then third aspect I would mention, there are a lot of boxes here, but third aspect I would want to mention is there is very big focus on overall patient experience. And it is not just essentially just a video channel to reach out to the patient, but a lot of these providers are kind of working towards creating this awesome patient digital patient experience for their patients and general community. So these are some of the observations, trends, and some of the drivers, Dean, from our perspective.
I'd like to thank Chris and Vinod for kind of setting kind of the foundation for what's going to happen next, which is we're going to move into kind of a roundtable discussion. You guys have set the context, kind of given everyone an understanding of, you know, the importance of telehealth and virtual care. It's primary and it's in a lot of our minds right now. But, you know, moving into the roundtable, I'd like to, you know, ask a question, and that is, and we'll start with Brian. Dr. Brian, what are some of the secondary challenges that you guys are seeing, or that, you know, you're seeing in the industry that you know, health systems are facing right now? Yeah, I mean, we've seen revenue, we've seen a lot of different things, but there's got to be some secondary challenges that are popping up.
Yeah, that's a great question, Dean. There certainly are. Going around the traps, talking to a number of clients around the region, we're seeing some common themes. We're seeing falls in revenue and activity, primarily due to cancellation of elective procedures and also reluctance of patients to present themselves to physical facilities as well. The Royal College of Surgeons, I think, predicted very recently that 12 weeks of isolation and also diversion of resources would probably result in cancellation of around 28 million elective procedures worldwide. And so that gives you an idea of the scale and scope of the number of cancellations that are going on and its impact on revenue and activity. Very recently, the Australian College of Emergency Medicine also published results that indicated around 10 to 30% falls in patient presentations to EDs around the region as well. So that's another interesting statistic, and speaks to the fact that patients are being dissuaded perhaps from presenting even for emergent conditions for important care. And obviously there's going to be a significant mental health burden as well. We know from our experience with SARS in Hong Kong, for example, that patients reported around 25 to 33% increase in reporting of high anxiety type symptoms. So we're probably going to see a mental health impact both on frontline staff in areas where they're perhaps making decisions around allocation of limited resources and direct patient care. And then also for patients and consumers in general, as coronavirus is entering the zeitgeist, it's also impacting individual people with pre-existing mental health conditions and predisposing situations towards creating down the track a greater mental health burden on the system as well. And we're also interestingly seeing some staff realignments as healthcare organizations are scrambling to meet COVID needs. We're seeing creation of pandemic response teams, realignment of traditional medical specialties into response teams. We're even seeing incorporation of non-medical staff into hospital teams, such as airline staff that are being redirected from their furloughed jobs into directing patients through the journey of going through a field hospital. And so traditional institutions that have been based around physical buildings for over 150 years are now finding themselves trying to set up facilities in previously unforeseen physical sites and creating new teams as well. And obviously, Chris touched on this earlier, a shift towards outpatient and ambulatory care as well, away as there's been a downshift in inpatient and elective encounters.
Chris, would you like to follow on that? I mean,
Yeah.
We're going to move on to the, make sure each one of you gets a chance to chime in here and pick up where Dr. Tan had left off.
Yeah, thanks. And I can build on a few things Brian's talked about there for sure. So I think first off, probably that contact center and inbound inquiries challenge I kind of alluded on earlier. I think that's been a very real challenge. Suddenly having to handle an increase many times over of inquiries has been, really, really quite a major challenge. Of course, employee safety and training has been very top of mind as well. So everything from onboarding a high volume of staff, ensuring really strong safety training and compliance, training folks in a digital environment, managing contact tracing with employees and, how to safely manage their wellness status and shift planning. I think the other one we've seen is definitely challenges around utilizing data more effectively. So think about PPE management, for example, and getting visibility of how much equipment we have, where it is, so we can ensure that facilities have enough supply. And then even, quite small everyday things I think have had to be rethought. So I touched on earlier, things like waiting rooms. something so routine requires quite a bit of thinking to adapt. And we've seen some really quite clever solutions emerge there around, things like utilizing text messages to patients or their carers so they know when they should present or when they can be picked up. So that's probably just a couple of other ideas there. But Vinay, I'd love to hear what you're thinking as well.
Yeah, I agree with you, both of you, Chris and Brian. I would like to, add a couple more points. I think because of pandemic, what has happened is it has impacted really some of the specialties from clinical standpoint because, those patients are not, trying, I mean, they cannot get into hospital because of obvious reasons. And that has created a little bit kind of a care deficit where all these patients will be queued up for whether it is cancer screening, or other elements of the care continuum, right? And I mean, as simple as urgent care related workflows, they are not happening. For urgent care, you need to kind of wait. You need to kind of consult with your doc over phone, and those kind of elements are kind of taking place. However, I think this will have longer term secondary impact where all these patients are a little bit queued up in the queue, and that is going to kind of put more stress on health systems. And I think some of these health systems are kind of switching over to digital channel to take care of that kind of population. But I think more, I want to kind of draw attention of this group more towards the fact that this entire increasing care deficit that these providers need to address sooner than later because of seriousness of these disease conditions and how it impacts overall patient health. That is where most of the effort and most of the attention is there from secondary impact standpoint.
Thanks, all three. I'm going to move on to the next question that we've received from some of the folks, and one of it is how can technology itself, how can it help the providers address these, I mean, primary and really the secondary impacts, right? There's revenue shortfalls, there's care deficit, there's space, right? There's space situations like, Dr. Tan had indicated they're having to set up new facilities. So what can we use the technology? How can providers use the technology to overcome the challenge? And Dr. Tan, I'll start with you.
Thanks, Dean. Yeah, I think technology can really help us in a number of ways. It's incumbent on us, I think, as technology providers to encourage our healthcare organizations to continue to expand their reach to vulnerable and rural populations, for example, and also into the patient's home. We know, for example, that in rural and remote communities, the life expectancy, at least in Australia, is about 2.5 times less. The requirement for potentially preventable hospitalization, the rates are about 2.5 times less than their city counterparts, and that the life expectancy is lower for rural and remote populations, both males and females, than their city counterparts as well. So it's probably incumbent on us to continue to encourage our healthcare clients to expand their technology capabilities to reach those vulnerable populations, also in Aboriginal and Torres Strait Islander populations and in the criminal justice system. Coming to a physical facility shouldn't be a barrier to good care anymore, and really virtual care is becoming a bit of a misnomer. It really should just be care as a standard part of healthcare. I'm also seeing realignments amongst our client organizations in terms of finding new referrer networks as they try and reestablish new revenue streams. How do they use technology to identify and then create new relationships with their referral networks? And also manage coordinated care of chronic disease is another area where I'm seeing our clients looking at technology to improve insights into their patient needs from a patient-centric viewpoint. What's interesting is that we're seeing government and private payers changing reimbursement-related rules around telehealth. And certainly with the federal move towards consumer-directed care, it's going to make the market a lot less sticky for patients sticking to any individual healthcare organization. So it's incumbent as well on the healthcare organizations to put in place technology to improve the patient experience and make that experience more sticky for their customers.
I can probably build on a few of your points there again, Brian. And I think just on that experience point you just noted there, I think that providers have typically been great at the care itself. The real trend that we were seeing emerge prior to COVID was providers really trying to get better at the engagement before and after the care happens, and really care outside of the four walls of the hospital. And I think COVID's really exposed that gap, and sort of accelerated that need even more to build up that digital maturity. But I think in terms of how technology can help there, everything from firstly improving patient acquisition, and that digital experience online, then by really connecting up that early part of the journey with a really seamless inquiries and admissions process, then transitioning into the care itself with, virtual care delivery options, such as what we're talking about today. But then I think also really importantly, actually following that actual treatment, technology can play that really important role in providing engagement, information and reminders to ensure stronger care plan adherence, and ultimately better clinical outcomes as well as a result. So I think that'd just be my build on Brian, is that, overall technology can support what can be a much more positive and engaging patient experience, but I think at the same time be a much stickier relationship and drive that relationship between the provider and the patient from a business perspective at the same time.
Yeah.
Thanks, Vinod. Yeah, if you wanted to, I was just going to say, can you pop in there and have any comments on that question?
Sure. So as technologist, this is great kind of time. We have been talking about this whole virtual care and digital transformation in healthcare, and entire this healthcare ecosystem, pushing them to kind of adopt these technologies for a number of years. So and this is great time where we can see that because it is necessary for healthcare systems to kind of reach out to their patient, and there is no other avenue but to adopt these digital technologies. It is great to hear that, right? And great to experience, and be part of that journey for healthcare organizations to enable them to establish these channels and deploy these technologies. I think this is a great time for healthcare systems also to kind of adopt technology to solve their, and it has become real kind of a necessary to kind of go on this path. So that is one thing. Second thing is regarding how technology exactly will help providers. We have been working recently. We are working with one of the health systems where they're trying to start their COVID journey for the patient right from chatbot, right? Because they don't have enough providers to attend to those number of patients. So, and there isn't like enough number of nurses to attend to those calls. So what we are trying to do with this particular provider is to start patient journey on chatbot, and then chatbot will ask certain questions, and then chatbot is intelligent enough to kind of change those questions and decision looking at how patient is kind of responding to some of these questions, and then we are routing this conversation from chatbot to real agent, and from real agent to PCP. So we are trying to kind of help these health systems to use technology really as a weapon to kind of cater to their needs currently. And this, I can really see that this really nicely fitting into landscape that they are trying to develop, and we are helping them across the board. So this whole notion about synchronous and asynchronous visits for the patient is kind of all those worlds kind of merging together, right? So that is another observation I have. Third thing is more on what Chris and Brian were kind of pointing on, is more on patient experience side, where we see that just the way patient experience is important, I think provider experience is also equally important. And now all these providers are kind of, I see there is a total shift from being on a little bit kind of resistance side to being on solution side. So earlier, provider would say, oh, by the way, if you adopt telehealth or virtual care, then how would I do this, right? But now same kind of provider segment is kind of coming up with solutions saying, okay, so if I answer these questions this way, then will I be able to kind of go and talk to my patient or virtual channel, right? So I think it is very interesting to see how providers are also thinking about adopting technology. and they can really see the impact that technology has. And these are some of the examples, maybe chatbot, maybe video channel to interact with the patient, maybe remote patient monitoring, and then proactively alerting certain physicians or certain care team about patient situation. All these are kind of results of providers and entire healthcare system looking at technology with a little bit open mind. And because of necessity, all of this kind of everybody's kind of forced into looking at it a little bit positively, from that perspective. So those are like some of the elements where we have seen how technology will basically help healthcare providers deal.
Fantastic. I think my next question is really a setup question. I think in reality, listening to what you guys have already been talking about, what the topic of our discussions are, but really coming down to it, is telehealth a wave of the future? Is it here to stay? Do we see different developments or different ways that we're going to be using this in the future? So I kind of think that, the answer is yes in most cases, but I'd like to say, if we, let's take the next yes, but, or yes, and, or what do we have? Is it here to stay, and in what form are we going to see it coming forward?
Dean, maybe there's a third option. Not yes, not no. It's absolutely yes. Is probably that third option, that telehealth is certainly here to stay. COVID-19 has accelerated telehealth uptake, the model that uses it, and it's created efficiencies for patients and clinicians. We've seen Medicare reimbursements of telehealth consults, for example, grow from a grand total of 800,000 consultations over the years 2011 to 2019. That's about 9 years worth, an aggregate total of 800,000 over those 9 years in toto, grow to 5.4 million reimbursed telehealth consultations just in the month of May this year. So there is no doubt that this is a turning point for telehealth. I think also there's a cultural shift. Vinod alluded to it in his last couple of minutes. There is a cultural shift amongst clinicians in terms of acceptance, and it is not so unusual now to hear some specialists refer to about 70% of their consults being via telehealth over these last few months. As clinician acceptance and healthcare is notoriously introverted in terms of its acceptance of new technology quite often. I'm seeing a cultural shift as I talk to my friends and colleagues in the healthcare space. I think the expectations of patients will also help drive and embed this kind of change permanently. The kids these days have different expectations of technology and what it can bring. The Uberization of a lot of services has meant that consumer expectations are changing dramatically. And we're also interestingly seeing a couple of niche areas where telehealth providers are being provided from international sources to cover that 24/7 patient access to healthcare. So there are international providers also providing telehealth services for that 24/7 coverage. It's essentially about meeting the patient when and where they need healthcare.
So on this one, I might agree and disagree with Brian, just to be a little bit controversial. So I think telehealth is here to stay, but with some limitations around it. And, as we've obviously shared today, there's a lot of reasons to believe that it's going to grow, particularly in the longer term. I think at the same time, it's no secret that the Treasury is nervous about the potential of telehealth to really blow out Medicare costs. So it's been no surprise, I think, that we've seen the government start to limit telehealth consultations to patients from their existing doctor, for example, in recent weeks. So I think we'll see telehealth stick around, but with some guardrails set around it to contain the MBS cost. I also think that as telehealth becomes more mainstream, it's likely we're going to see more regulation start to come in around telehealth and, tightening up particularly around the privacy considerations around this. So I think we'll see a move probably beyond very simple conferencing tools being used, and likely a bit more investment starting around more comprehensive platforms, for that security and compliance purpose. But it's good, we've got a bit of debate going here. Vinod, I'd love to hear where you're sitting on this one as well.
I'm going to go with Dr. Brian. I think I agree with him that telehealth is here to stay. But by the way, I also agree with Chris that there will be more need for different kind of tools and technology that will make sure that both the parties on both sides of telehealth platforms are really who they say they are, right? So there would be a more need for biometric authentication and other kind of tools that will make sure that right person is getting care advice and right person is getting care across the spectrum. So that is one. Second thing is, I think this will evolve. Currently, because of pandemic, what has happened is basically everybody has brought in these tools and kind of they have set it up just to make sure that they can interact with the patient. But I think this will morph into more like a platform approach where long-term care or chronic care will be delivered using telehealth as a kind of a delivery channel. And furthermore, I think it will expand a lot into, and this is very, very useful, from saving standpoint, for payers, whether government or commercial, monitoring these patients for certain conditions and then providing them care proactively, and which will be personalized care. I think that's where telehealth will go in my mind, and this will expand further into different kind of specialties, different kind of care situations. And technology is very hungry to serve to this kind of population from that perspective. So I think there will be kind of a conversion of all these different problems to kind of one streamline thought process to extend this telehealth beyond just seeing your patient, but really monitoring that patient for patient good, and then basically delivering that care using telehealth as a channel. So this will be a perfect assistant to doctor to care for their patient, and then basically, and that's where I think telehealth is going from my perspective. Oh, and by the way, Dean, I just wanted to mention one more point is that I think this will be start of different kind of business models in healthcare. I think combination of payer, pharma, and provider will, I think, and because of telehealth is at the center, I think this will kind of pan into more very interesting business models across these healthcare ecosystems. That is like very, very interesting opportunity or business opportunity for all these constituents of healthcare ecosystem to kind of look at from that perspective.
And thanks all three. I have here a yes or an absolutely yes, a yes but, and a yes and. So I think we're kind of in agreement here that it is, it is a wave. It's something that's going to be here. It's going to be sticky, using Brian's and Dr. Atan's terminology. But I guess the biggest question moving in, and Vinod, let me start with you, is what advice do you have for health systems, right? When they're looking into the system or systematically looking to get started in telehealth in a more scalable way, right? Right now, we're having pockets of it, they're coming in, but if we're looking at it for the yes and long term, or Chris's yes but, that poses the question: what do they need to do? What advice do you guys have that the health system should be taking and considering?
Yeah, let me start with current situation, Dean, right? Because when this whole COVID thing started, and then everybody was kind of scrambling to attend to these patients, and there were providers who had certain kind of arrangement for these kind of technology solutions, and there were providers who did not have anything. So providers who did not have anything, they started putting together a quick and dirty solution to address the problem. And I think more or less, I would say, larger set of providers do have, or healthcare systems do have, some kind of telehealth solution or some kind of virtual care solution. I think since this was put together in a hurry, of course, some of the important points, nobody had kind of bandwidth and time to think about some of the very important aspects of this entire solution. And one of the very, very key important aspect is user experience. And when I say user experience, it is on both sides of the tunnel, patient experience as well as provider experience. Now, I was in some other forum where we are talking to providers. So provider was saying that, Now, earlier, patient used to wait for me in waiting room, but now I'm waiting for patient, to join me on, video chat. The point I'm making is basically experience for both these user segments is very, very important. And I think as we move forward, there will be fine tuning of that experience, from technology standpoint. So experience for both patient and provider will be next step in my mind. Second thing is fine tuning the process and workflow, because again, because we didn't have option, everybody kind of rushed to the solution. But now, one needs to kind of take a step back and really think about how do I bring more providers, more departments, more specialties on this telehealth, platform, and then what are their specific needs, right? And depending on, certain specialty, for example, if you take example for orthopedics, they may have different kind of need than oncology, for example. So I think there will be time where we need to kind of fine tune these different specialties, and how do we make sure that they can use this digital channel more efficiently. I think there will be focus on that. The third part is learning from data, right? So we have been using, our healthcare systems have been using these platforms or some form of virtual care. So what is the utilization, where exactly we are getting reimbursement, where exactly we are not getting reimbursed. So I think learning from that data will be very, very important aspect, and that's where I think there will be more focus on fine tuning these solutions and these technology elements. So that's what I think, Dean, will happen next.
Yeah,
I'm just saying we're on a time check here. We've got a few minutes before we have to start that. So I was just, hit the highlights there, Dr. Brian and Chris. So let's hit those most important points. And then secondly, I would say this is the last question that we have before we move into the demo. So if there are folks, the attendees, if there are questions, please put them in the chat, and they will be captured, and then we can address any questions you may have that our panelists didn't address, or if you'd like to go deeper on, then we can then reach back out and make sure we're addressing any questions you guys may have. Thanks, Brian.
Yeah,
go ahead.
Thanks, Dean. Yeah, I just want to quickly echo Vinod's comments. I think it's important to consider the patient-centric patient experience and not just focus on the provider workflow. What we're trying to achieve really is build capabilities that provide smooth, easy to access, easy to choose kind of experiences for the patient. But on the clinical workflow side, also build those capabilities into the workflow of the clinician so that they're able to access those technologies at the right time, because we know there's an attrition rate if they have to switch systems all the time as well. So out of the box ways to pull in remote devices and results is really important, as the clinician needs to think about those diagnostic clues, and also being proactive. So incorporating actionable predictive alerts that's context sensitive as well are really important. And just think about governance in your organization as you put in place these technologies to ensure that the technologies are appropriate, that they're safe for the patients that you're serving at the same time.
And my quick suggestion there, Dean, I think just to think end to end about the experience you're trying to create. A lot of emphasis tends to go into the telehealth consultation itself. That's obviously very important, but it's actually a relatively small part of the entire end-to-end experience. So it's often those parts before and after that can be missed. So thinking about how will patients find your facility online? How will they schedule appointments in a really seamless way and receive reminders and notifications? What will happen after the consultation? How will we maintain the engagement and follow-ups and care plan adherence? I think that's probably the key piece to think about, just to ensure we convert that great opportunity to have a longer and stickier relationship with the patient as we deploy telehealth.
Fantastic. I'd like to thank all three of you for lending us your insights, information, and again, any questions that we capture from the attendees here, we will forward on so that you guys can address and provide that information back. We want to make sure that we do address all the questions. Before we move into the demo very quickly, one of the outputs, or one of the solid things that Salesforce and partners like Persistent do, is they have great working relationships. And with Persistent and Salesforce, we've had a 12-year relationship, and are really, really happy to be able to partner with Salesforce on activities like this, and where we can bring information that's going to help communities, help health systems and do that kind of stuff. So you can reach out to both Salesforce and Persistent on this topic. We'd love to continue talking and go deeper if there are questions that you have. I can't emphasize that enough. There's a lot of systems out there that are struggling for answers, and I think both Salesforce and Persistent are there to help you guys work through it, help the industry work through these situations. With that, I'd like to add or introduce two new panelists or two additional panelists. It is Jeremy Powell, who is Persistent's chief architect, one of our Salesforce chief architects, and he is based in Australia. And the other is associate vice president in our growth and solutions team, Yashraz Baswar, and they're going to be running the demo. So if we can give them the ball and hand over the presentation mode to them, I will let them take us forward.
Thank you so much, Dean. So what we are going to look at is there are three things we are going to show today. Televisit is part of our digital front door offering. We are going to see three ways a patient can have interactions with each other. The first one is a Heroku-based application, which is very closely developed with Salesforce Health Cloud. So you see this is the patient application. This is Salesforce Heroku connected with Salesforce Health Cloud with Heroku Connect. As a patient, as Chris was talking about, that very important pieces after the televisit, how do we keep patient engaged? So that's the most important KPI we are following too, which is My Care Plan. For a patient, My Care Plan is set up by the physician. As I go inside that care plan, I see the physician has created certain set of care plan and treatment plan for me, and I can see the problem I am facing, the goals which are given to me, and then the set of activities to be completed. What is supposed to be completed today, I can also add note and mark that as done. So this is an integral part of that patient engagement throughout the care continuum. Along with that, let's quickly take a look at this particular app, which gives us ability to run assessments, self-scheduling, which is a very important ability, scheduling e-visit, definitely we're going to see that one, medication, lab reports, and so on and so forth. So let's quickly take a look at how we can schedule an e-visit. Here, this is a self-scheduling ability. The data at this point is coming from EMR to Health Cloud via bidirectional integration by leveraging MuleSoft, and then from Health Cloud inside this Heroku app with Heroku Connect. This is a way I can search very quickly the physicians which are available. And as you can see, this is bringing in the first availability slot. So it helps me make a decision which physician I would like to go and meet. So let's say I am confirming an appointment. So as you can see, it's very seamless for a patient to schedule an appointment. Along with that, let's quickly take a look at other things. For example, medication. Now, medication is something which is prescribed by physician. If you have any questions, you can ask question, and this is also templatized for ease of use. Similar functionality is also available for lab reports. You can take a look at the various lab reports and ask questions. We have given an ability for patient to raise a transport request, send out messages, contact, as well as we have a graphical in symptom checker. Now, this is a very useful tool for patient as well as someone who just wants to make sure that whether it is really important to see physician and in what capacity we need to see. So for example, if somebody wants to take a look at what's happening with a 3-year kid, you have a very graphical way of taking a look at this one, and it's fairly simple. You click on the area where you would like to go. So for example, if we are facing, let's say, the child is complaining about some pain, chest pain, you click on it, and as you can see, there are 3 categorization: get help now, get help soon. So depending on the symptoms, there is a guidance, care advice given to the patient and patient's family. Now, this is in accordance with Dr. Smith-Thompson's pediatric protocols as well as adult protocol. So this is pretty much clinical in nature. Along with that, we have also included some parent advice like dosage and some other advice which might be clinical as well as non-clinical in nature. So this particular app which we were looking at is quite comprehensive to extend that patient engagement which Brian and Chris were talking about. Now let's quickly take a look at that e-visit which we are looking at. So at the back end, when you schedule a visit, there is marketing cloud journey to send you set of reminders and emails to make sure that there is you show up for the appointment. Lack of appointment visits or no-show appointments is a big revenue cost. So marketing journeys does setting a marketing journey does help in that particular piece. Now here I go there when I get a reminder. I go in my appointments. I see there are a set of appointments which are created, and as a patient, I check into this one. Now the entire televisit infrastructure is based on multiple components like Salesforce Health Cloud, Heroku. We are leveraging Vonage for this particular visit, and all of these are data compliant and GDPR compliant. So as I check in, as you can see, I am getting into the physician's waiting room. So as I go here, I get into physician's waiting room, and as I get there, physician gets notified. Physician is also joining. Hello, Dr. Jeremy, how are you? So it's a fairly seamless visit or fairly seamless affair for both patient and physician to actually initiate this conversation. As you can see, I can also have some set of conversations with the physician. Thank you so much, Dr. Jeremy, for joining this call. And as you can see, with that, I click on this one, and it just pretty much ends my televisit. So this was the first way of looking at first way of looking at how easy it is to schedule an appointment. Now let's quickly take a look at the second way of looking at it, which is let me look at the second way. Now this one is something which is where a patient has not downloaded an application. Okay, so let me see if I can be the presenter now. The host, can you make me?
You are the presenter, Yash.
Okay, thank you so much. Appreciate that. Thank you. So what we just saw, the first way of looking at it, the patient, if it is an existing patient, patient has downloaded the mobile application. There is another way of looking at it where patient can also go to patient portal, which is developed in Salesforce community, and the same set of functionality is available there. What if the patient is a new patient and patient has not downloaded any application? And that is the demonstration we are going to see today. Patient calls up the call center, they schedule an appointment, and patient receives, as I was saying, patient receives some kind of notification. And now we are going to see that as patient logs in and is nearer to his appointment, the physician gets notified, and physician initiates conversation or televisit. As you can see, I have received an SMS. As patient, I go in that SMS, I click on it, fairly simple. I have a link, you can see it's secure. All of this is powered by Vonage's secure platform. You click on it and you initiate a conversation with physician. So as you get into this one, physician clicks on it, and as you can see, Dr. Jeremy has again logged in. Fairly simple one-click activity for patient and physician to initiate the conversation. So with that, let me quickly close this. Fairly simple, patient close this one and patient comes out of it. So what we have seen is the second piece, the televisit, without anybody has to download any application. All they need is SMS. Now, all these three ways of initiating these televisits are powered by our patient access solution accelerator, which is built on Salesforce Health Cloud, and it is tightly integrated with backend EMRs, billing, and other systems using Salesforce MuleSoft. So the entire infrastructure is built on Salesforce products as well as Vonage. So with that, let me pass it on to Jeremy, who is going to show us a glimpse into patient access solution accelerator.
Cheers. Thanks a lot for that, Yash. So I'll share my screen now and show you what the view looks like from a physician's point of view. So what you're seeing here is the physician logged into the system, and they're currently looking at a particular patient, Cindy Crow. And there's actually quite a lot of information that they need to see about a patient. So I'll just quickly talk you through what you're seeing here. So down the left-hand side, we've got a patient navigation option that allows them to quickly navigate to any important information they need. Below that, we have the patient's high-level details, and below that, a patient card. So this summarises a lot of associated information like their languages, their medications, immunisations, allergies, etc. And this is all pulled from their electronic health record or EHR system. In the centre of the screen, we've got an alert at the top of the page for any important information the physician might or the user might need to see. In this case, Cindy was unable to schedule an appointment to visit her dermatologist. Scrolling down the page, we can see demographic, patient, address information, etc. In the main section of the page. Scrolling down, we can see a lot of information sourced from third-party systems. So this is our EHR data where we're seeing conditions, allergies, immunisation, prescriptions, procedures, and lab work. And I've just got the conditions exposed here at the moment or expanded. So we can see Cindy's conditions are hypertension, high cholesterol, she has an irregular heartbeat, and she recently suffered a heart attack on the 20th of July this year. So we can utilise all of this information to actually get risk insights into Cindy. So we can actually score her to see what sort of a resource utilisation she might be on the healthcare system. So here we can see that back in March, this is just a US state format, she actually had quite a high risk score for utilising a lot of resources. That was brought down in May, but now since she's had a heart attack, it's actually starting to go back up again. Similarly, we can see Cindy's readmission risk going up based on her symptoms. And these scores are actually based on the risk predictions. So if I just scroll there quickly, we can see a number of risk predictions that the system is making. And this is based on some machine learning, taking Cindy's symptoms and conditions into account with her medications, and actually using that information to make predictions on Cindy's health. So we can actually see there's a risk of readmission for heart failure. She's in the 50th percentile, and the patient is at an increased risk of readmission due to heart failure, due to age, symptoms, etc. And we can see this particular model is based on a machine learning algorithm based on a cohort of 50,000 heart failure patients with deep clinical data. This might be, if I just open another one. So this is a high resource utiliser risk. So Cindy is at a high risk of utilising a lot of healthcare resources. And we can see this is based on a cohort of 60 million patients. So it's just giving the physician a little bit of insight into how we've created these risk predictions or how the machine learning algorithms have come up with these. Quickly down the right-hand side, we can see an engagement hub. So this gives us a quick overview of the patient, the last interaction that we had, as well as all of the appointments, triage, all of the conversation history, all the mobile SMS messages, all the email interactions and call logs that we've had with Cindy. So there's a complete overview of every interaction both the physician and anyone else has had with Cindy. Lastly, I'm just going to demonstrate that we can actually send an SMS directly to Cindy to jump on a telehealth call. And the physician can initiate that by sending an SMS, which I've just done, and then initiating the video chat simply by clicking the link here. So this opens up the telehealth view. You can see me down here in the right-hand corner and Yash, our patient, in the centre. So we get to see some high-level information about the patient. We've got real-time chat capabilities as well as being able to take notes. And all of this is stored at the end of the call on a secure, compliant server. that we have access to in the future. That's a really simple demo and just an overview of what a physician sees from their perspective. So that's probably the end of the demonstration for today. So I'll turn it back over to Dean.
And thanks, Yash. Thanks, Jeremy. I appreciate it. And if you guys could make me presenter again, just so we can close out. Let me share my screen. I'd like to thank everyone who, all of the panelists today, Chris, Brian, Vinod, Jeremy, and Yash for their insight and information. We'd like to thank the attendees for spending time with us to learn a little bit about our perspectives on how we can help you with telehealth and virtual visits. If you do have questions, please send them to persistent.com/COVID-19, and we will be able to get the right people to answer your questions and make sure that we can. And if you'd like a greater in-depth opportunity or greater in-depth demo, we are more than happy to make those accommodations. So at this point, again, thanks to all for your participation, for your attendance, and hope to hear any questions you may have. And have a great rest of your day. Thanks again.